So thank you for tuning in to our OHB Advantage video. Every year at Ohio Health Benefits, we get more and more of our Medicare supplement people calling us wanting to know about the noise that they're hearing on TV about these Medicare Advantage plans. And so this video is designed to sort of address that subject. There are more and more commercials, especially during the open enrollment period. And when I say commercials, we're talking Joe Namath and Medicare Martha and Jimmy Walker commercials, all talking about these getting the extra benefits that you deserve. People with Medicare supplements may be confused by that and wonder, why am I paying all this money and not getting this stuff? So that's the reason we're going to do this video. We are celebrating 20 years at OHB this year. I'm happy to say that. So some of these slides will reflect, the difference we've seen in the last 20 years from 2004 to 2024 and what's going on in the market. If you're on a Medicare supplement plan, and again, that's sort of what this video is designed to address, you know how they work. You know that you have a Medicare card that you're carrying. You have a Medicare supplement plan that you're paying for that you also carry, and those two work hand in hand with each other. And then you have a third card in your wallet, your Medicare Part D prescription plan. And so that's the path you're on, using these three cards where Medicare is primary and is basically paying 80% of your claims after deductible, and then your Medicare supplement is picking up the 20% in the claim and picking up at least the hospital deductible. And depending on what plan you have, it may also be picking up the $240 Medicare Part B deductible. So that's path one. There's also this path two, and you may or may not remember when we sat down with you, we talked about the two different paths. Or maybe you actually didn't get your plan from us and you got it from somebody else and you never talked about path two. And path two is the Medicare Advantage plans, the HMO plans, and again, those plans that you're hearing all the commercials on. So we want to talk about why we're seeing more and more enrollment into the Medicare Advantage plans now than when we got in business 20 years ago, and how the trend is continuing to go up. So this slide is a great representation of what's going on in the market. This is a national slide produced by the Kaiser Family Foundation that shows the increasing enrollment in Medicare Advantage plans. And on the left of the slide is 2007, when about 19% of people had Medicare Advantage plans. And all the way to the right is 2023, where for the first time, more than 50% or 51% of people in this country have Medicare Advantage plans. Now, Ohio Health Benefits got started in 2004, so to the left of the slide, it was about 15% of people that had Medicare Advantage plans. So there's been this significant increase in enrollment in Medicare Advantage plans over the last 20 years. Kaiser Foundation predicts that in another 10 years, there will be about 62% of people using Medicare Advantage plans. So they think the trend will continue. I certainly think the trend will continue. One more point regarding the increase in Medicare Advantage plans and what's driving the increase. And that is that if you know friends or family that are lucky enough to have employee retiree medical coverage when they get to Medicare, and the company they retired from is paying for the plan, most of those plans are Medicare Advantage plans. For example, in the state of Ohio, if you retired as a teacher and you're on the state teacher retirement system plan, there's over 150,000 people in that situation. Those people are enrolled in Medicare Advantage plans. So that's also driving the fact that even though there are fewer and fewer companies offering retiree coverage, if they do offer retiree coverage, more than likely what they're offering to their retirees is a Medicare Advantage plan. So I want to go over the 10 reasons that we are seeing an increase in enrollment in Medicare Advantage plans. Things like premium increases, the extra benefits, the larger networks, the flexibility to go in and go out of network, or the flexibility, say, to go to see doctors outside of the state if you're in that situation. So we'll cover that in these slides. Maybe the number one reason why when we meet with somebody turning age 65 and that they decide to go on a Medicare Advantage plan or not, maybe the biggest reason they decide to do that is when they look at a Medicare Advantage plan and they see that the plan has a network and the plan has co-pays, they're already used to dealing with insurance like that from their insurance at work. Most plans at work have networks. Most of them have deductibles. In some cases now, many of the plans have very high deductibles. And so if you compare your group coverage that you're leaving to what you can get on a Medicare Advantage plan, many times what you're comparing to, the Medicare Advantage plan that you're comparing to is actually richer in benefits than the group plan. So there's sort of this thought that if it's good enough for me while I'm working, well, this is even a little better. Why is that not good enough for me going forward? And so because of that, that's one of the big reasons why we see people going into these plans. What we've seen, we did a study last year and we looked at the enrollments that we did in 2023. And for Ohio Health Benefits, we enrolled 1,560 people into Medicare for their first time in Medicare. Whether they were turning 65 or whether they were leaving an employer plan, but these are people that came to us and wanted help with the Medicare and figuring it out. And we presented Path 1 and Path 2, Medicare Supplement and Medicare Advantage plans. And we try to do it as objectively as possible, although we will give our opinions when people ask. But from looking at our numbers last year, Ohio Health Benefits, 71% of our enrollees went into a Medicare Advantage plan, and only 29% chose a Medicare Supplement plan. And I don't have hard numbers on this, but if we looked back at 2004, when I first got started in the business with myself and Dave, I think it was flipped. I believe we were probably writing about 70% of people on Medicare Supplement plans and about 30% on Medicare Advantage plans. So there's just been this sort of flip and a continued increase. And part of it is the fact that, hey, people are retiring from their job, they're used to networks, they're used to out-of-pocket costs, they're used to co-pays, and that's how Medicare Advantage plans work, and they're fine with that. Second reason we're seeing growth in Medicare Advantage plans is if you've been on a Medicare supplement plan for a long time, you know that the premiums continue to increase as you get older. Premiums never go down, they never stay the same, and it doesn't really matter what insurance company you're with, but you're seeing this increase in your premiums every year. And it doesn't matter how much you actually use the plan that drives the premium, you're just part of a pool of people. And as that pool of people gets older and is utilizing the services more, the premiums will continue to go up. So depending on how long you've been on the plan, you might have started out with a plan that was, the low $100 per month, and you may be in a situation now where you're paying $200 or more per month for your Medicare Supplement premium. And so that's also a factor. As that number gets higher and higher and higher every year, and you compare that to the co-pays and what you pay on the Advantage plan, it could make sense to not have to pay those premiums anymore and switch over to the Medicare Advantage plan. In Ohio and in most of the states, there are many, many Medicare Advantage plans that have a zero monthly premium. When we enroll somebody, more than 90% of the people that we enroll in Medicare Advantage plans enroll in a plan that has no monthly premium. So if you're paying for your Medicare Supplement now, you wouldn't have to pay for that anymore, and you wouldn't need that. And in fact, you're not allowed to have that with a Medicare Advantage plan. And if you're paying a premium for your prescription plan, you wouldn't do that anymore because the Medicare Advantage plans include the Part D coverage. And you could sign up for a plan that has a zero monthly premium. Well, when we talk about that, people get an inquisitive look on their face and they're confused and they don't understand it. How can an insurance company provide me something with any value whatsoever if I'm not paying them some money to do that? And so here's how that works. When and if you go on a Medicare Advantage plan, you're really signing a contract that says you're now going to use Medicare, or you're going to use the Medicare Advantage plan company as your coverage for your Medicare. So Medicare Advantage plans, which are also called Part C, and the commercials like to say that, and I always say C stands for confusing, but Medicare Advantage plans, they don't supplement Medicare. They don't pay after Medicare. They take the place of or they replace your Medicare. And so if you go on a Medicare Advantage plan, you're signing a contract that says that insurance company is now going to be your Medicare. And when and if you do that, whichever insurance company that you select, they get paid by our government to handle your Medicare for you. And it's a very significant amount of money. The national average is about $700 to $900 per person per month is what these insurance companies are getting paid for to have you on their Medicare Advantage plan. So it's significant, $10,000 or more per year is what these companies are getting paid. So that's the good news for the insurance company. The good news is they get that money. The bad news is they are now responsible for paying your medical claims. And so they get the money, but they also get the risk associated with the money. So the government is transferring the risk. They no longer are going to pay claims, and the insurance company is going to pay the claims, and you're going to pay copays. Now, even though you don't need to use your Medicare card and you don't show your Medicare card when you're on a Medicare Advantage plan, you do still have to pay your Medicare Part B premium. Some people forget that they're paying the premium because the money's coming right out of their Social Security check. And if you are a high wage earner and you have a high income penalty, you have to pay that as well. So you're not going to beat the system by going from a Medicare supplement plan to a Medicare Advantage plan and not have to pay your Part B premiums anymore. You do still have to pay that. However, you won't use your Medicare card, you won't show your card, you don't carry your card. When you go to the doctor for the first time and you say, I have a Medicare Advantage plan, and you give them that card, when they ask to see your Medicare card, the doctor will understand you're with this Medicare Advantage plan. We won't send claims to Medicare. We will send the claims directly to the insurance company. So that's how there can be a lot of very good plans that have zero monthly premium. While you're not paying anything for the plan is getting paid significantly by our government to handle or take the place of your Medicare for you. Medicare Advantage plans have networks. Your Medicare Supplement plan does not have a network. With a Medicare Supplement, you can go see any doctor, any hospital, anywhere in the country that accepts Medicare. With a Medicare Advantage plan, you're either in an HMO or a PPO plan. Most of the time, a significantly high percentage of people that we enroll in HMO plans because the benefits are stronger and the out-of-pocket costs are lower than a PPO plan. And so even though they're HMO plans, they're not the old Kaiser model that says you have to have a referral or you have to go to a certain facility to get your X-ray or your test or your MRI. The Medicare Advantage networks include major hospital systems, and you can go to those different hospital systems to seek the services that you're looking for. So you can get a plan in Northeast Ohio that includes Cleveland Clinic and includes University Hospital and Summa Hospitals and Akron General and Metro and Mercy and Altman and Western Reserve. So even though they're HMO plans, these plans are very large in their networks, and they include those hospital systems and the doctors that are employed by and are part of those hospital systems. So if you are considering a Medicare Advantage plan, we're going to ask you what doctors you go to see, what hospitals you want to go to. We'll check the networks. We'll make plan recommendations, and there may be many plans that will allow you to continue to go to the doctors and hospitals that you want to use. However, we may find out that there's some doctor that's not part of a Medicare Advantage network, and it could be a dermatologist or an eye doctor or a chiropractor or something like that. And if so, we'll let you know that. But I'm confident that we'll be able to find many different plan options for you that won't make you change your current doctors. One of the things that's newer with Medicare Advantage plans that's come about in the last couple of years is that there are now several Medicare Advantage plans that offer national HMO networks. And so you can enroll into a plan now that allows you to see doctors and hospitals throughout the country within the HMO national network. And that's a newer thing. That wasn't in existence 5 years or more ago. But now there are plans. So all Medicare Advantage plans have to cover you in their service area with their network, and they all have to cover you outside of the service area, including all of the states for emergency or urgent situations. But we're starting to see Medicare Advantage plans now that do have national networks. So you could live in Ohio and have a home in Florida or South Carolina or Arizona and have a network with a Medicare Advantage plan that allows you to see doctors in those other states that are part of their national network. And that's a newer trend that we're seeing, which is good news for people that maybe are snowbirds or have a home in another state and they want to be able to see doctors in either spot. However, again, regardless of that, remember that all Medicare Advantage plans do have to cover you throughout the country for any emergency or urgent situation, whether they're part of a network or not. Medicare Advantage plans include the Part D drug coverage. So where now you're carrying a third card for your Medicare Part D, you can get a Medicare Advantage plan, carry one card in your wallet, and it also includes the Part D drug coverage. And for the most part, the Part D drug coverage is actually a little bit richer with Medicare Advantage plans than it is with a standalone drug plan. And it's richer really in two ways. In one situation or one instance, the Medicare Part D drug plans built into the Medicare Advantage plans may have no or a very low deductible, where most of the standalone Part D drug plans do have a deductible. So now you can get a plan built into your Medicare Advantage plan that has a drug coverage and maybe not have a deductible. The other thing is that the formularies tend to be a little bit larger with the Medicare Advantage plans, which means they maybe cover more drugs that would be important to you. And two, there are more drugs on the Medicare Advantage plans formularies that are low tier drugs that have a 0 monthly copay. So you can actually get richer benefits for the drug coverage with a Medicare Part D plan, with a Medicare Advantage plan with the Part D than a standalone Medicare Part D plan. For 2025, we're expecting some pretty significant increases in Medicare Part D premiums for the standalone drug plans. And that's due to legislation that's coming down the road or that's in place that's put into effect in 2025. So while you may be on a plan now that has a very low or even a 0 monthly premium for your drug plan, we have several thousand people on an existing Medicare Part D plan that has a 0 monthly premium, and there's another plan that has a $5 premium. We expect those premiums to be significantly higher in 2025. So enjoy your 0 premium plan now and your $5 premium now. I think personally that we're going to see Medicare Part D drug plans that are going to have premiums that maybe on the low side are going to be $30 a month, and on the high side we may be getting into $60, $70, $80 per month. So that factors into your decision as well, where if you're not paying a Medicare Part D premium now, you may be paying a significant one in 2025. So watch for your notice, your annual notice to come in the month of September or early October, and look to see what your plan's doing for next year. If we see a significant change in your plan for next year and you're a client of ours, we will definitely be reaching out to you to have the discussion about reviewing your options and maybe changing plans for next year. But at the same time, you could consider going on a Medicare Advantage plan that include the Part D, and we don't anticipate that there'll be significant premium increases on Medicare Advantage plans for next year. So one of the differences I pointed out on Medicare Advantage plans compared to your Medicare Supplement is that they have copays for things that you do. And if you're on a Medicare Supplement, you're not used to paying copays. You may be not used to paying anything at all if you have one of the older Plan Fs, or if you have a Plan G, you're paying a low, reasonable deductible, but then you don't pay after that. Well, that's not the case with Medicare Advantage plans. Medicare Advantage plans do have copays for things that you do. However, there is a limit to the number of, or the amount of the copays that you would pay in a year. The limit, we call it a MOOP, or a maximum out-of-pocket, M-O-O-P. The limit built into these plans is usually a number around $4,000 to $5,000 per person per year. So if you have a Medicare Advantage or a Medicare Supplement plan now, and you're thinking, if I leave that and I go to a Medicare Advantage plan and I have to pay all of these copays, how bad could it actually be if I have a really bad year and I'm really sick? How bad can I get burned? And the answer is, it's whatever that max out-of-pocket is for the plan that you're on. And again, usually the number's in the $4,000 to $5,000 per person per year range. And so we've been told that less than 10% of people on Medicare Advantage ever hit their MOOP. It could happen. And so you could be on the hook for up to $4,000 or $5,000. When we talk about the plans, we'll let you know what the maximum out-of-pocket is. That may be playing into your decision. You may want to go with a plan that has a lower maximum out-of-pocket than maybe one that has a higher out-of-pocket, but that's all part of deciding what plan you may go on if you decide to leave that. But just know that you're not going to get burned by hundreds of thousands of dollars or even tens of thousands of dollars of medical claims if you leave what you have and you go on a Medicare Advantage plan. You're protected by this maximum out-of-pocket, by the plan, and once you hit that limit, then the copays go away. You can utilize the services for the rest of the calendar year and not have to pay the copays anymore. So what do the copays look like on Medicare Advantage plans? Well, typical copays for the most part are reasonable. Doctor appointments could be anywhere from a $0 copay to maybe a $40 copay. Many of the plans will give you a primary care doctor copay of $5 or $0. And specialists are usually in the $30 or $35 or $40 per visit copay range. Emergency room visit could cost you $90. An MRI or a CAT scan might be $150. An urgent care visit might be $35 or $40. If you need x-rays, it might be $10 to $50 for x-rays. A hospital stay is a bigger number. If you go to the hospital and you're inpatient, generally the plans charge you a copay of about $300 for every night you're in the hospital, but there is a limit to the number of nights that you have to pay for that. Normally it's 5, 6, or maybe 7 nights. So if you had a plan that had a $300 copay per night, and you had to pay for up to 7 nights, if you were in the hospital for 7 nights or longer, 7 times $300, it would cost you $2,100. That $300 copay, however, does cover everything that they do to you and for you while you're in the hospital. So there might be an anesthetist bill, there might be a surgeon's bill, there might be MRIs and CAT scans that they do. All of those bills are going to the insurance company and they have to handle the bill, and you're only responsible for the copay of whatever the copay is. Let's say in this example, $300 for the number of nights you're in there. And so if you're there more than 7 nights, you don't pay the $300 anymore. And that amount of money does apply to the MOOP, the maximum out of pocket. So if you had a full week in the hospital and it cost you $2,100, you're now $2,100 closer to reaching your maximum out of pocket for the year. If you repeated that in a year and you went back to the hospital and you had another week there and it cost you another $2,100, and let's say your plan had a $4,000 maximum, well, you will have met the maximum. You don't pay any more than the $4,000 for all of the copays that you've spent for the year, and anything going forward for the year would be no copay. So you are protected by this maximum out of pocket, but you will pay copays for things that you do. All Medicare Advantage plans, as I mentioned before, do include emergency and urgent coverage. So if you're out of state and you have an emergency situation, you're going to pay the emergency room copay. If you get admitted to the hospital because of the emergency, then you would pay the hospital copay just like you're in state. And again, that copay, the amount that you pay would apply to that maximum out of pocket. If you reach that, then you're covered 100% after that. So now let's talk about all the extras, right? This is all the noise in the market. This is the commercials that's going on. This is your neighbor and your friends bragging about all the stuff that they're getting that you're not getting, right? It's the extras. Well, what we've seen over the last 4 or 5 years is that the extras have been getting much richer in these plans. The insurance companies have gotten very creative in coming up with things that they can propose to you or put on their plan to try to get you to jump on their plan. Things like dental coverage, things like vision coverage, hearing aid coverage, over-the-counter benefits, maybe a card to help you buy groceries. Things like that are put on the plan to attract you are part of most of these plans now. And because of that, and how rich these benefits are, that's also driving this trend for people to leave their Medicare supplement and go on a Medicare Advantage plan, or just start out their Medicare with the Advantage plan. Because again, if you're working for an employer, you may not have things like this, and you're getting some of these benefits that you don't have. So the extras are a very, very big deal. So I'll talk about some of the extras, right? Dental's probably the biggest deal. People love to have dental coverage. We get lots of people asking for dental coverage. And even if you have a Medicare supplement and you may call us and say, hey, can I buy a dental plan? And we do offer plans. Many times they're not worth the money, but they are out there. But when you talk about the dental on the Medicare Advantage plans, they are much richer in benefits than any plan you can buy on your own. And they're really richer for 2 different reasons. One reason being Medicare Advantage plans cannot have a waiting period for the dental services that you need because it's part of a Medicare Advantage plan. Whereas if you buy your own dental plan, more than likely it will have a waiting period. It may not pay anything for a cap or a crown for 6 months or 12 months, but they're not allowed to do that on Medicare Advantage plans. So Having no waiting period is a very nice benefit. You can begin to use the dental benefits the first day that your Medicare coverage kicks in. And the second thing that is better with the dental plans, the dental as part of the Medicare Advantage plans, is that they have higher out-of-pocket limits. They will pay more for your dental services. Most dental plans that you buy on your own have a limit of maybe $1,000 or maybe $1,500, but they don't go much higher than that. Where there are many Medicare Advantage plans now that maybe offer $2,000 in dental or even more, $3,000. So you can get more dental built into the Medicare Advantage plan than you can get with a standalone plan, and you can get coverage for the expensive things without having to have a waiting period. Vision and hearing is part of these Medicare Advantage plans. You can get $2,000 or $3,000 per year to help pay for hearing aids if you need them. You can get a couple $100 per year to help you pay for eyeglasses, and you can get a routine eye exam covered for no charge. Over-the-counter benefits. This has been a big deal in the last couple of years, where the insurance companies will give you a debit card, and on the debit card, they'll put $50 or $60 or $70 every quarter that you can use at the pharmacy and get things like Band-Aids and Tylenol and supplements and toothbrushes and toothpaste, things that you're using all the time, and they're just putting money on the card that you can use and spend on those items. So it's just the insurance companies, again, getting creative, coming up with cool things to offer to their Medicare people to try to get them to join the plan. And so as a broker, as your agent, we like this stuff, right? It makes it more fun to enroll people in these plans. It's nice for people to enjoy these benefits that they didn't have before. And so again, these extra benefits are a big deal. Some of the plans will offer meals. They'll send meals to your house after you've been inpatient in a hospital. Or they have a transportation benefit to drive you to and from doctor's appointments. And almost all the plans do still include a fitness center membership. So if you like silver sneakers or you have a fitness center membership, you're not going to give that up. Medicare Advantage plans do offer that and include that into their plans for the most part. So if you like that benefit, certainly you'll be able to keep a benefit like that if you go to a Medicare Advantage plan. So let's talk about Part D for next year. What's going on with Part D? Well, as part of the Inflation Reduction Act of 2022, Part D is getting much richer in benefits, really starting now, but significantly more in 2025. And this is actually very good news for people who use a lot of medications and a lot of high-cost medications. And the big change for next year is that there will no longer be a donut hole, the coverage gap, right? The other big deal is that prescription cost, outpatient prescription cost, will be capped at no more than $2,000 for 2025. And that's a significant improvement over Part D when it first came into existence in 2006. To have a cap of just $2,000 in benefits is a huge benefit for people that have a lot of high-cost medications. Currently in 2024, the cap's about $3,300. So there's a $1,300 benefit, a richer benefit for next year. So that's great news for people that use a lot of high-cost medications. The bad news is for people who don't have high-cost medications, or people who don't use any medications, or people who say, hey, my drugs are really low cost. I can get them for $4, I can get them for $10, or I'm using this GoodRx card. I don't even use my Part D plan. For those people, we anticipate, or for everybody, we anticipate Medicare Part D premiums increasing significantly in 2025. So say goodbye to your zero premium Part D plan. Say goodbye to your $5 Part D plan. That's an opinion, but I think it's pretty solid based on what's going on. We think Medicare Part D premiums are going to go up significantly next year. So watch the notices that come out. Watch for your ANOC, your annual notice of coverage change, and see what's going on, and then give us a call. If we know something bad is happening to your plan, we're going to reach out to you. We'll know some of that stuff in the summer months and even in August and September, but brokers and agents are not allowed to talk about that with Medicare beneficiaries until October 1st or until you get your ANOC. So we'll reach out to you. If we know this problem's coming, we'll want to gather information to reevaluate your prescription plans for next year. At that time, you may decide, hey, my Medicare supplement keeps going up, Now my Part D premium is going to be very high. Maybe it makes sense to switch over to a Medicare Advantage plan. You may decide you want to go without a Part D plan. We don't recommend that, but if you do that, there are some penalties in the future, and you would be uncovered for prescription drug plans and couldn't get on a plan until the next open enrollment. So we don't recommend that, but there may be people that consider that. But again, we want to look at your Part D options for next year. We want to maybe talk about Medicare Advantage plans if you're thinking about that includes Part D, and get you in the spot you're comfortable with for 2025. So are you a good fit for a Medicare Advantage plan? There's a few things that go into that. I would say one of the things that drives that is, are you getting tired of what your Medicare supplement premium is today? Are you tired of the fact that it keeps going up every year and it's getting more and more expensive, and maybe it's $200 or more per month, and you're starting to pay $2,000 or $2,400 or close to $3,000 a year in premiums, which is approaching what the maximum out of pockets is on these Medicare Advantage plans. And if you're getting tired of that and you don't feel like you're getting your money's worth out of your Medicare supplement, it may make sense to look at a Medicare Advantage plan. Do you have the FOMO, right? The fear of missing out. You're tired of hearing your neighbors and friends talk about all the extra stuff that you're getting, and you're not getting that. You're paying this high premium every month. You're not getting dental coverage. You're not getting hearing aid coverage. You're not getting the over-the-counter benefit. You're not getting the meals allowances and things like that. And if you feel like you're missing out on stuff, maybe it's time to take a look at the Medicare Advantage plans. Maybe you just decide, hey, I don't use my Medicare supplement much, right? I've been healthy. I don't have many medication costs. Do I really need to keep paying for a Part D plan? Do I really need to keep paying for a Medicare supplement when I can go to a plan that has a very low or a zero monthly premium in a Medicare Advantage plan, get the drug coverage, get the extras, not have to worry about a penalty later if I drop my drug plan, and enjoy the benefits that you get with your Medicare Advantage plan. There is one thing I want to talk about here, and that's the 12-month free look period. So what if you leave your Medicare supplement and you decide you want to go to a Medicare Advantage plan? Can you get back to what you have now? Very important question to be answered. And the answer is this. If you drop your Medicare supplement plan and we enroll you into a Medicare Advantage plan, and it's the first time in your life that you've done that, if you change your mind and you want to go back to your Medicare supplement, you can do that in the first 12 months of being on your Medicare Advantage plans. Medicare calls that a trial rights or a free look period. And so you can change your mind in the first 12 months and get back to your Medicare supplement and not have to worry about will they accept you and will they cover you or not. However, after that 12-month period, if you want to go back to a Medicare supplement plan, you would have to answer medical questions and say yes or no to the questions. And if you say yes to a question, they can deny you the coverage or keep you from getting it. So some of the questions are things like, do you have a pending hospital stay? Do you need a joint replacement? Are you scheduled for a surgery? Are you dealing with dementia or Alzheimer's or Parkinson's disease? Things like that, if you check yes on the box, they won't cover you on the Medicare supplement. So you could find yourself in a situation where you drop your Medicare supplement and you go on a Medicare Advantage plan, and later on in your life you want to go back to the Medicare supplement and you can't get it. They won't accept you. So you want to be aware of that. There is, however, a chance where you could have those medical conditions and you could go back to a Medicare supplement even with those medical conditions. And that would be in the case of if you had a Medicare Advantage plan and you physically moved and went to a different area that no longer offered the Medicare Advantage plan. All Medicare Advantage plans are county and state specific. And so if you move out of the county and now your plan is no longer available, you do have to change your plan. And with a Medicare supplement, that's not the case. You can move about the country with your Medicare supplement and still be covered. But with a Medicare Advantage plan, if you move, you will have to change plans. Well, if your plan is not available in the new county or the state you're in, you can get any one of the Medicare Advantage plans offered in that county, but you also can get a Medicare supplement without having to answer medical questions. So you would be guaranteed issue. You could enroll in another Medicare supplement, not have to answer those medical questions, and get coverage. So that's an important thing to consider, that if you were to move, you could get back on a Medicare supplement anytime throughout the year. within limits of the time that you move and get on a Medicare supplement plan. Upon getting to the end of this, should you stay on your Medicare supplement plan or should you go on a Medicare Advantage plan? We can't really answer that question for you, but I would say this. There are a couple of cases where I would say you would not or should not leave your Medicare supplement plan. And the first one would be this scenario. If you're a person that says, I want to be able to go to any doctor or any hospital throughout the country to seek medical advice and to treat me, that would be sticking with a Medicare supplement plan. If you said, hey, I want to go on Google and find the best doctor to treat me because the Cleveland Clinic can't figure it out, or University Hospital can't figure it out, or SUMA, or all the local hospitals can't figure it out, but Google or WebMD is saying, hey, you need to go to Texas and go to this place for your treatment. As long as that doctor, that provider, that facility accepts Medicare, you can do that with your Medicare supplement, but you cannot do that with a Medicare Advantage plan. You would have to have a plan that would include that doctor in the network, and that would be very risky. It would be very difficult to find a plan, and you can't change plans in the middle of the year. So that's one scenario. The second scenario is if you have significant medical condition that might make you reach your maximum out of pocket every year with a Medicare Advantage plan. And one of those conditions would be kidney dialysis. If you are receiving kidney dialysis 3 days a week, with Medicare Advantage plans, you have to pay 20% with that. And you would pretty quickly reach your maximum out of pocket with a Medicare Advantage plan if you were receiving dialysis. And so unless your Medicare supplement premiums are more than the maximum out of pocket, we would highly advise you to stay with the Medicare supplement plan so that you don't have to meet or pay that maximum out of pocket year after year after year. Even though we said less than 10% of people ever reach their maximum out of pocket, people with kidney dialysis would meet their maximum out of pocket every year with a Medicare Advantage plan. So that's the two scenarios where we would be talking you out of enrolling in a Medicare Advantage plan if you thought you wanted to do that. So what are the next steps? Really, the next steps are up to you. If you think you want to look at a Medicare Advantage plan, give us a call. We want to gather some data from you. We want to talk about the differences. We want to sit down with you and go over what the options are. And we can do that anytime throughout the year. You can't make a plan change anytime throughout the year, but we like to have those conversations when it's not as busy. We're super busy. All agents in this space are very busy October, November, December. But we'd like to have those conversations earlier in the year if we can. We will have those conversations during annual enrollment, and we have a lot of those conversations. But don't delay calling us if you say, hey, it's July and I'm thinking about Medicare Advantage. Let me call in the fall. Call us now. We can do some legwork up front. We can sit down with you. We can meet with you. We can say, let's pretend you could enroll in a plan today. Let's do the full analysis. Let's make a plan recommendation for you. We'll give you the book. We'll give you the documents. We'll let you read through it. You can thumb through it and think about it for several months, talk to more people, and decide whether you might want to do that. And then in the fall, when we get the new plan information for the following year, we'll reach out to you and we'll say, hey, here's what's going on with the plan. You want to make the change or not? So bottom line, give us a call now and we'll talk to you about it and we'll gather data and help you out. So thanks for listening to my video. For our current clients, I want to remind you we've got a great service team. If you're struggling with your plan for any reason whatsoever and you're getting frustrated, please give us a call. Certainly you can call the insurance company first. Many people do that. But if you're starting to get frustrated with that, we want to take your problem and fix it for you. So we've got a great team of licensed agents that are on our service team. They can handle the problem for you. So again, if you're a client of mine, give us a call and we want to help you out and make sure that you're happy with what you're doing. Thank you.